Hi, my name is Brandon Santhumayor, and I'm delighted to present our work on the impact of cerebral revascularization on Pial collateral flow in patients with unilateral Moyamoya disease using qMRA. So Moyamoya disease is a progressive steno-occlusive arteriopathy of the intracranial circulation, and due to decreased perfusion, leptomeningeal collaterals can form from neighboring vessels to make up for this deficit. However, if the collaterals are not adequate or exhausted, patients can still suffer from ischemic and/or hemorrhagic events and may need revascularization in the form of a bypass. So we identified a gap in the literature in potentially using quantitative tools to assess shifts in blood flow, both through these major vessels and the collaterals in this patient population following bypass surgery. So we did a retrospective cohort study with adult patients with angiographically confirmed unilateral Moyamoya disease to better focus on one hemisphere. We leveraged our institution's usage of qMRA with non-invasive optimal vessel analysis, or NOVA, to obtain blood flow rates. We focused on the MCA, A2, and P2 vessels and formulated three separate variables: total hemispheric flow, which was A2 plus MCA, plus P2 with the bypass graft added in postoperatively; Pial collateral flow, which was the difference of the ipsilateral A2 plus P2 and the contralateral A2 plus P2; and collateral ratio, which was the collateral flow divided by the contralateral MCA for a normalized ratio. 34 patients were ultimately included in our analysis, and the key takeaways were that after bypass, there was a significant increase in total hemispheric flow from 227 to 247 milliliters per minute with the addition of the bypass graft, and a significant decrease in collateral flow from 68 to 39.5 milliliters per minute. So in conclusion, hopefully this work has convinced you that qMRA NOVA can be utilized to quantify potentially exhausted collateral reserves and patients in need of revascularization. Future studies that use NOVA to assess the Moyamoya population should also evaluate flow in relation to stroke and hemorrhage risk. And finally, I'd like to thank my co-authors for their tireless support on this project, and we gladly invite you to browse our full manuscript by using the hyperlink below.